Indonesia is bracing for a worsening COVID-19 outbreak. Authorities have warned that the Delta variant is spreading fast. 57,000 new infections have been confirmed, yet another single-day record. Indonesia is now said to be the new epicenter of the pandemic in Asia, having exceeded India's daily tally.
It's a familiar sound in Indonesia. Ambulances weaving in and out of Jakarta traffic, trying to get COVID-19 patients to hospitals. In some areas, hospitals are flooded with patients, forcing hundreds to die at home. It's the worst-case scenario authorities have warned of, even though Indonesia is now under some of its toughest virus curbs so far. Daily infections have increased more than tenfold since the start of June. Just days ago, authorities had said they expected the curve to flatten soon.
Kasus meroket ini sudah kita duga juga akan terjadi, mungkin terjadi, tapi tidak kita duga terus terang secepat ini. Tapi balik-balik karena pemahaman kita mengenai Delta varian ini juga banyak yang yang tidak paham betul. Anda sudah lihat charts tadi, jadi bukan hanya kita caught by surprise, banyak negara lain juga yang kena. Karena ilmu kita, ilmu dunia ini kedokteran juga belum sampai ke sana.
Officials are considering an extension of mobility curbs that are set to end next week. But that may be a precaution many Indonesians cannot afford. As businesses suffer, more than 1 million more people have been dragged below the poverty line in the past year.
Saiful Bari Ismail joins us live now from Jakarta. Saiful, authorities are now bracing for up to 100,000 daily cases?
Well, that's the grim scenario authorities in Indonesia are looking at. However, they hope that scenario will not happen. But Coordinating Minister for Maritime Affairs and Investment, Luhut Panjaitan, whom you heard speaking earlier, said the government will be preparing how best to mitigate the pandemic if daily COVID-19 cases rise up to 100,000. Last week, Mr. Luhut, who is also the coordinator for tackling COVID-19 in Java and Bali Islands, said the government has prepared for a worst-case scenario of 50,000, 60,000, maybe 70,000 daily COVID-19 cases. So fresh infections have now surpassed 50,000 a day, and authorities now have to prepare for a much worse case scenario if and when COVID-19 numbers reach 100,000 a day. Currently, hospitals are overwhelmed, but the health ministry said it still has the capacity and it's still something manageable. The government has converted buildings into isolation facilities, deployed fresh graduate doctors and nurses to treat COVID-19 patients, and imported treatment drugs and oxygen. The government has also accepted international help. It is still unclear if the emergency public activity restrictions will be lifted or extended beyond 20th July. Authorities said they will need to evaluate the current conditions before deciding if the emergency public activity restrictions will be extended or not. Health experts believe the next few days will be critical to see if the partial lockdown measures are working. The emergency public activity restrictions started on 3rd July, and usually it takes about 2 weeks to see the results of the restrictions due to the lag from the moment a patient is tested, his result, and finally recorded by the central government. Now, health experts have urged the government to extend a partial lockdown at least until August. They said there needs to be a sustained effort to really bring down the infection numbers. However, the government is also aware of the danger of a prolonged partial lockdown, especially on the economy. Mr. Luhut said there is a limit on how much authorities can bend the bar before it finally breaks. However, the scenario may be that the Indonesian government has pledged that its people will not go hungry. President Joko Widodo has ordered aid in the form of rice to needy residents. Authorities are also rolling out social assistance in the form of direct cash transfers to poor families.
But also, Saiful, not to mention that, Hari Raya holiday is happening next week, and surely there must be concerns that that could trigger another explosion in cases.
Yes, there are concerns of another spike in COVID-19, possible spike in COVID-19 cases as Indonesia commemorates Hari Raya Haji or Eid al-Adha next Tuesday. Coincidentally, that is the last day of the emergency public activity restrictions. Under this partial lockdown, all places of worship will be closed, and authorities have reminded residents not to conduct Eid prayers in the mosques. They advised people to just pray from home. However, in the areas which are in the green zone, where there are low or no cases of COVID-19, residents can conduct Eid prayers in the mosques, but with only 50% capacity. Authorities have also urged residents to restrain themselves and not to go visiting and to limit their movements. Police said it is better to stay home because many roads will still be blocked to restrict mobility. Now, Eid al-Adha is also a day of sacrifice. Many Muslims will slaughter cattle and give the meat to the needy. The slaughtering is usually done at the mosques or open spaces. Authorities have urged those who are conducting the ritual to do it at the slaughterhouse. One reason is that the mosques will be closed anyway. They have also urged residents not to congregate outside the slaughterhouse to receive their share of the meat. This is to avoid overcrowding. Organizers of the ritual said they will deliver the meat to the beneficiaries, so there is no need for people to wait outside the slaughterhouse.
Very many thanks for those updates from Indonesia. Saiful Bar Ismail there.